Good afternoon, everyone, seniors, respected seniors, my colleagues. Dr. Srinivas sir is here. Uh, so today is a very different thought process I want to take you all into. We are getting wounds, we are treating wounds, but we are not thinking about limb salvage. There is a difference. The difference is when we talk about limb salvage, it is all about regeneration. This is the paradigm shift we need to think about. Okay, so there is a lot of research need to be conducted in this field. Why? Because we know every 20 seconds, every 30 seconds, a limb is getting amputated. 1 lakh amputations are happening. We are focusing on the 1 lakh amputations, how many surgeons are there, how it is going to be preventing amputations, or how to treat these amputated wounds. But our target should be the 1,000 crores of population in the world, out of which almost 300 crores of population is diabetic. That is the target. We don't want them to get a wound. We don't want them to develop an ulcer. Why talking about no amputation? Why not talking about no wound? This is the research we need to do. Now, all the research which you are getting is from abroad, from Western countries. But do India have research of its own? Does India have a database? There the population is different, having a different culture, different food, and different environment. In India, we have different food, different culture, different environment. Our mindsets are different. Do we have studies, data related to that? If we don't have, how are you going to prevent amputations? So it is not about tissue loss, it is about livelihood loss, which is happening in India, and India is a developing country. The whole magic we need to create, do the research is only on this blood circulation. If this peripheral blood circulation is not good, no matter how many newer advanced dressing materials you may bring into the market, no matter how much of offloading you may do, from internally, the leg is getting bad. And even after so much of things, that will end up into an amputation. And amputation is a temporary solution. Amputation is never a permanent solution. Because post amputation, the survival, 50% is maximum 1 year. So what are we doing? We need to start research and working on our population. What is needed for our population, for our climatic conditions? So there is a lot of gap. 80 million diabetics. That is the target, not 1 lakh amputations. We want to save these 80 million people from getting amputated. Not people who are coming with wounds. We want to do a dressing, how to do the dressing, do what. Now we have so much of advances that have come into market that even the doctors don't know. How will you convey it to your patients? So a lot of research is required. So we are not facing a wound problem as such. Anybody is treating wounds nowadays, but we are facing a system problem. The system is not correct. So there are 4 pillars we need to focus on. The first is early detection and risk prediction modules. The future of diabetic foot research must start before the ulcer itself begins. Because in Indian reality, 80 plus millions are diabetics and 15 to 25% are having a chance of developing a foot ulcer, and 50% present in the later stage. And post healing, 40 to 50% chance of recurrence are high within 1 year. And majority of the ulcers are grade 2, which are highly preventable. So we are not working on prevention. We are waiting for the ulcer to grow and then do a debridement and ultimately into an amputation. Infection control. Indian microbial mapping has to be done. It is different from the Western world. The biofilm targeted therapies have to be focused on, not just betadine dressings. Rapid bedside diagnostics. There are so many recent advances have come up, especially on INR, infrared. Infrared is the upcoming thing. If you have an infrared device at your home, at your clinic, you can do wonders. So coming to the infection statistics also, 60% of the diabetic foot patients are having infection, and 5 to 10 times the chance of amputation is high in the infected wounds. And after amputation, 50% are having mortality within 1 year. And what is the cost which is increasing? One leg is getting amputated in a family, the whole family is getting affected. And India is a developing country which majority of the middle class population. So 60 to 70% of the India is getting affected if proper research is not conducted in this field. So what research we have to do? We are already having newer dressings, right? What research we have to do? We are thinking about ulcer management. Why not think about revascularization? Why not think about neovascularization? Why not think about new nerve sensations development? Why always think that neuropathy is going to be permanent? Why do you think vascular issues are going to be permanent? They are reversible. We are talking about diabetes reversal. We should talk about neuropathy reversal. We should talk about vascular reversal. We should talk about regeneration. So coming to regeneration and healing, PRPs, very common, but we are reluctant to use. Hyperbaric, of course, it is not so easily available for everybody, but yes, it is trend setting now. We are not talking about stem cells. We have stem cell banks. We have stem cell banks we get from outside. In India, how many stem cell banks are there? We have such a large population. We don't have stem cell banks. We don't have dermal substitutes bank. We import from Australia. We import from Germany and from US. Why India is not having? India being the maximum manufacturer of collagen is being imported, is being exported outside, but we are not using for ourselves. So coming to regeneration, the statistics shows that only 10 to 20% of stem cells are being used in DFU management. That is also recently. HBOT is recommended for grade 3 and grade 4. How many wounds are actually getting it? 20 to 30% PRPs are recommended in the recent RCTs. And 30 to 40% wounds are becoming chronic and ultimately ending up in non-healing wounds and turning into a gangrene because no advanced technology has been applied on that. They just want regular dressings. Biomechanical and offloading. This is another research area. How many patients of us who are all treating diabetic foots are happy with the footwear? None of them. Somebody suggests airwalkers, like there was a discussion. And yes, airwalkers are so heavy, nobody wants to use them. You want to put a posterior slab, but patient will walk on the posterior slab, the posterior slab will break off. By the time patient comes back to you, it's a broken slab. So ultimately, the things is repeating. And Indian culture, we don't wear footwear at home. So we'll wear those nice offloading footwear, keep it outside home and walk barefoot inside. And then they come back with the patients saying you have a wound which is not healing, the doctor is not good. And they change the clinician. So biomechanical, so it is all about not just research, it is also about awareness, creating awareness. The kind of awareness which we need to create, because unless we learn it, how we are going to tell about advances to our patients. And a patient comes to us, being a general surgeon, we see initially it was like appendix. People now are asking, so you have laparoscopy in your management? Can you do laparoscopy in your appendix or hernia or hydrocele, whatever conditions are there? But is the patient coming and asking us, do you have VAC? Do you have dermal substitutes? Nothing, because we ourselves don't know what our patients will know about it. So first, creating awareness and doing a lot of research on an Indian data is important to make Telangana state an amputation free, make India an amputation free country. Coming to statistics, 85% of the lower limb amputations are following an ulcer and they are all highly preventable. Now, how this ulcer prevention looks like? Now, this is a wound you see. This wound, if it have come to any general surgeon, they have debribed it and end up into an amputation, right? But with the advanced technologies, we are working on regeneration. Now see how the growth has come with proper dermal substitutes, increasing the vascularity, increasing neutral status of the patient. The wound gradually started healing on its own. And the end result is so good that it doesn't even look that the limb was supposed to get amputated. Now this is also a necrotic wound. front and back, this is the condition. Everybody wants to do an amputation. But then, with the advanced technologies, with the latest oxygen therapies, with the latest PRPs and the offloading guidelines, the wound started healing, dermal substitute applied, skin grafting done. Now the tendon is also saved. The wound is healed, the toe is saved. But yes, getting back the function, that matters. Now you got back this function, now chances of recurrence is less. So getting back the function by creating regeneration. Now this is old story. This man is 87. Most of the patients with diabetic wounds, they have a lot of pain in them. They come with lot of agony, lot of pain, loss of interest in life. This man is 87 years old and his children were abroad and he was in a old age home. His wife is expired, he's alone. Now this is a foot and everybody said go for a below knee amputation. He was pretty sure that after amputation, if he go back to the old age home, nobody will be there to even take him to the washroom. So he said, sir, not just my leg, you also cut my throat so that I can happily go away. But then we have so much of advanced technologies. We could save this limb. See the color change, see the granulation tissue that's come back. And not just that, from this level to this level, even no extra inch of skin is lost. Grafting done, wound healed well. Not just wound healing, we made him walk back again. He's walking back on his leg, the one who wanted to die. And now see the confidence, how he's sitting. We gave back a life at the age of 87. Now this is also a very sad story. This man is around 60 and he has a wife. He loves her so much. He always takes her on a bike ride. Now he developed a diabetic foot. Now he is ready to lose his limb. Vascular surgeons opened up the vessels, but then there was a repercussion injury and the satellite nodule, they mistook it in a different way. Amputation was done, below knee amputation, and this is the condition. They asked for an above knee amputation. He didn't want any more amputations. But then, with the advanced technology, the wound healed, the bone got covered, and grafting was done. His life saved, because the more, if you can think, now in this case, we generally discuss like what next we can do. Why can't we go for a above knee amputation and close it off? Everybody thinks in this way. But the more you're going up, the more is the cardiac returning happening and the chances of survival is reducing. So even a half inch of skin you can save, you're saving his life. So it is not always amputation the permanent and the easy solution. Of course it is difficult, but yes, there is a chance that you can get these results. Now he is driving a car, that is his wife, and they're happy again. So from that place to this place, it was not easy, but yes, it is not inevitable also. Now this is also a very sad story. This man was a chronic smoker, he was diabetic, he had all the health issues possible, and he has an unmarried daughter. Now the daughter wants to save his dad because dad said if my leg is getting amputated, then sorry beta, I'll write a letter and leave some night. You won't even know. Because if this amputated leg, I can't make your marriage, I can't make you study further. I am a loser man in my own. So if I have an amputation, I'll die. That was his sentence. See that bad wound, almost 1 year gone, all the wound, they have tried everywhere. The bones were exposed, osteomyelitis, but yes, there was a lot of changes after stem cell therapies and hyperbarics which was applied. The front, back, everything is open. Everybody said go for a below knee amputation, but the man wants to die if there was an amputation. Now this was the initial picture of, now there is a change in the bone structure after stem cells. That is regeneration. Now the wound has healed, front, back, everywhere. But yes, this is still not in the position that it can bear its weight. So after that, external fixation was done with our orthopedic friend, and the man was started walking back. Not just walking back, now his leg is saved, his daughter is very happy, and I think next month he's going to make his daughter married. So national registry and outcome. We need to have a national registry because without that, our own Indian protocols are not possible. So because of the geographic variation, major amputations are happening. So that is the reason we should have our own national registry. So in short, I want to finish it by saying that we must shift from treating wounds, treating ulcers to preventing amputations. Research must serve preservation, preservation must serve mobility, and mobility must preserve dignity. That's all. Thank you.
Thank you, Dr.